Colon cancer, the third leading cause of cancer deaths in the United States, and mostly preventable. It's a disease associated with aging. So as we age, typically over 50, our risk starts to increase. And it starts to peak 60s, 70s. The process by which colon cancer develops is a slowly progressive phenomenon. It starts with cells that become abnormal, start to grow out of proportion or out of what they normally should. And those cells then form what are called polyps. And polyps, if left unchanged over time, will get larger, and some of those polyps will develop even further changes that lead to much more disorganized growth and actually cancer, where those cells will now invade into the lining of the colon and start to spread. This process takes years. So what we offer is a way of actually finding the polyps, removing them and removing the risk associated with their progression. So colonoscopy is usually recommended for most patients at 50. And that's the typical age of someone who doesn't have any significant family history of colon cancer or related cancers. So there's several other cancers that are interrelated genetically to colon cancer risk. Obviously, if your parents have had colon cancer or your siblings, then we will recommend it starting at 40. And then once we look, then we establish how frequently we need to look depending on what we find and that family history. Because colon cancer is related to genetic mutations that some of us inherit, and that those mutations put us at a higher risk of developing cancer. As a result, we may look more frequently in those patients than every 10 years, which is the norm. So if you have a screening exam at 50 and otherwise normal, healthy, no other risk factors, then we'll give you 10 years till your next screening exam. We use sedation here that puts people to sleep so you don't experience any discomfort during the procedure. Maybe a little gassy when you wake up from the air that we put in to look around. But most folks are feeling great afterwards, and we send them on their way to grab some lunch and enjoy the rest of their day. We'll also know once the pathology comes back if there are polyps removed, if there was anything significant or what needs to be done in the future in terms of how often we need to go back and look.